Give me the status update in terms of UNICEF's access to vaccines, how it's going to provide those to people. Where do you stand, and what's your timeline here?
UNICEF has launched a tender for procurement of vaccines against COVID-19 to evaluate all vaccine candidates. And the tender is currently ongoing and will result in purchasing agreements that will ultimately ensure vaccine availability for countries within next year. Timelines are not yet certain at this stage, but we expect some vaccine availability within Q1 next year.
Now tell me, I know you've been in discussions with airlines. We reported that last month UNICEF had a call with 40 global carriers about trying to figure out how to make the vaccine available to countries across the world. What are you talking about? What's the subject of those conversations right now?
So our initial objective is to engage critical partners in the logistics industry, airlines and other logistics service providers, to ensure that they are aware of the operation that UNICEF will be managing in terms of supplying the vaccine to at least 92 AMC countries. And in that context, we are sharing with them initial estimations around vaccine volumes, cold chain requirements, likely origins of the vaccines. Understanding none of this is yet confirmed, and we're working on qualified assumptions to ensure that they can make capacity available, and we initiate a dialogue to ensure prioritization and affordable rates when the vaccines are to be transported.
Yeah, well, tell me about those rates, because right now air cargo rates are at some of the highest they've ever been. How do you negotiate around that sort of reality?
Indeed, both in terms of capacity and rates, it's a difficult timeline in terms of the air freight industry. But the idea is to use the volumes that we will be transporting, as well as the criticality of this operation for, well, in terms of human lives, economy, and whatnot, to actually be able to plan with the airlines and ensure that that planning and the criticality of the operation contributes to make it as cost efficient as possible.
Are there any airlines that are on board right now on any level?
Works regularly with the largest procurer of vaccines worldwide, and we distribute vaccines, or we supply vaccines to countries for around 45% of the world's children. And these normally travel, and we transport them through airlines. So we are in regular contacts with some of the main airlines that serve the destinations that we normally supply to. And these are the ones that we are having a more intensified dialogue with to ensure that this operation, given it's very unique and special, will even be more successful and smooth than the regular vaccine supply.
Can you tell me what kind of routes are going to be most critical in terms of your operation?
The majority of the countries that UNICEF will be supplying vaccines to within the COVAX facility are essentially located in sub-Saharan Africa. So indeed, that's the key destination. Of course, there's also destinations in Middle East, Asia. So there's a wide variety of countries, and we're mapping all the routes, but the majority of them are into the African continent.
Now, I know you focus on the logistics of this, but clearly one of the headaches, I'm sure, is making sure that the vaccines, whatever they are, but particularly with COVID, get to the right people, the healthcare providers say out in the field. How do you look at that and make sure it gets to that final end person that is so critical? So
that's UNICEF works with partners within the COVAX facility, with WHO, Gavi, and other partners to ensure first allocation criteria, which is led by WHO, to ensure that the vulnerable groups within each country receive the vaccines or the first doses on priority basis. And then we work at country level with ministries of health, with partners, governments, and we do so on a regular basis for routine immunization to ensure that there's mechanisms in place in terms of cold chain, but also immunization strategies to secure vaccines and doses being distributed to affected populations.
Finally, talk to our audience of CEOs, business leaders, government leaders. Make an appeal. Is there anything that UNICEF wants to see, particularly from those transport partners that you're talking about right now?
I think UNICEF and its partners are embarking in what we call a mammoth operation, an unprecedented scale in terms of vaccine distribution that requires a collaborative approach and an all hands on deck. So we call upon industry partners to work closely with us to make their assets, their capacity available. It's only working with them that we can deliver. And for sure, to consider the criticality of this operation and to prioritize any shipments, any transportation of supplies, including vaccines, but also immunization devices, syringes, safety boxes that are needed to actually conduct immunization activities in countries and protect populations against the virus.